Okay, so here we are going to discuss the parotid gland anatomy, identify parotid duct and mention its surface marking. So the surface marking of parotid duct is at the middle, 1/3 of a line drawn between the intertracheal notch to the middle of the philtrum. So you can see here, this is the intertracheal notch. You can see here, this is the intertracheal notch, and this is the hair that's about the middle of the philtrum. So 1/3, the middle third, will be the surface marking of the or here will lie the parotid duct, which is about 5 centimeter and is also called Stenson duct. So it is the middle 1/3 of the line drawn between the intertracheal notch to the middle of the philtrum. Where does the parotid duct open? So crosses the masseter, passes the buccinator and the fat pad of the face and the mucous membrane, and joins adjacent to the second upper molar tooth, the Stenson duct. What are the structure passing through the parotid gland? From superficial to deep, so you can remember this of mnemonic, the Farad. You can say feared or you can say Farad. So facial nerve from superficial to deep. Facial nerve, sternal carotid artery, retromandibular vein, and the auriculotemporal nerve from posterior trunk of the mandibular nerve. Mandibular nerve has two trunks, the anterior and posterior. The posterior trunk gives rise to the auriculotemporal nerve, and the last is the deep parotid lymph nodes. Relation of parotid gland. So remember, interior we have the masseter muscle, medial pterygoid, superficial temporal and maxillary artery, and facial artery, and stylomandibular ligament. How to remember this? I will show you a trick. Posterior barrier of digastric is posteriorly because it is posterior, and the sternocleidomastoid muscle, stylohyoid muscle, and internal carotid artery, or you can say the internal carotid sheath, whole combination is there, mastoid process and the styloid process. So let me show you the trick. So here you can see, this is the lateral surface of the gland, okay, and this is the medial surface of the gland, this one. So the medial surface is divided into anterior medial and posterior medial. Okay, this is anterior medial and this is the posterior medial. So what is there? So here we have the, you can see here, this is the masseter muscle, so this is anterior medially. This is the mandible, so this is, or you can say angle of the mandible or mandible bone. So, and this is the medial pterygoid. So these 3M, these are the anterior medial relations, or you can say anterior relation. What are the posterior medial relations? So there we have the mastoid process, okay, this one, and the styloid process, this one, and all the structure attached to the styloid. We have the stylopharyngeus, okay, the stylopharyngeus, the styoglossus muscle, and the stylohyoid muscle, and the stylohyoid ligament, and the stylomandibular ligament. So all these structures attached to the styloid process and the styloid itself and the mastoid process, all these form the posterior medial relations of the so, and these structures, the facial nerve goes through the parenchyma, and the retromandibular vein and the external carotid artery, these goes through the and here this was the famous MCQ in the medical school, that the facial nerve is related to the anterior medial surface of the or you can say the terminal part or the branches of the facial nerve are related to the anterior medial surface of the parotid gland. So this is the trick for the relations. Okay, you can see the diagram here, you can remember this visualization. This is the masseter, okay, and here medially we have the pterygoid, medial pterygoid, and so on. So this was the trick in this diagram. This is a cross section from above. This diagram is cross section from above. Okay, so here we can see. Okay, so we have done with the relations, and now we have the vascular supply. So vascular supply definitely arterial supply is by external carotid artery, venous by retromandibular vein, and the lymphatic drainage to upper deep cervical lymph nodes. Then we have the nerve supply. So the nerve supply is sensory to great auricular nerve anterior of C2, C3 from the cervical plexus. So sensory to this capsule of the parotid is through great auricular nerve, which is anterior of C2, C3 from the cervical plexus. Okay, and the sympathetic is the superior cervical ganglion around the external carotid artery, and then we have the parasympathetic secretomotor inferior salivary nucleus in the medulla glossopharyngeal nerve tympanic plexus, and then the tympanic plexus give rise to lesser petrosal nerve, which is the preganglionic fibers. These relay in the outer ganglion, and the outer ganglion gives the postganglionic fibers, parasympathetic fibers in the auriculotemporal nerve, and so on. How is the retromandibular vein formed, and where does it drain? So by the union of the superficial temporal vein and the retromandibular vein. No, so this is wrong. Okay, the retromandibular vein is formed by the superficial temporal vein and the maxillary vein, and these combine to form the retromandibular vein, and the retromandibular vein then further goes wait, yes, so the retromandibular vein gives further. Okay, so how it is formed? So it is formed by the superficial temporal vein and the maxillary vein, and then these combine to form the retromandibular vein, and the retromandibular vein has anterior division, which drains into anterior facial vein to form the common facial vein that drains into the anterior jugular vein, and the posterior division of retromandibular vein joins the posterior auricular vein and forms the external jugular vein, which ultimately drains into the subclavian vein. Here you can see this is formed by the superficial temporal artery and vein and the maxillary artery and vein. This combines to form the retromandibular vein. You can see here they combine to form the retromandibular vein, and it has two divisions, the interior division and the posterior division. The posterior division joins the the interior division joins the facial nerve, which form the common facial nerve. The posterior division joins the external jugular vein. This is the external jugular vein, this one. So it joins here the external jugular vein to form the the retromandibular vein joins the posterior division joins the external jugular vein, which then drain into the subclavian vein. Okay, so here we have the regions drained by the preauricular lymph nodes. So preauricular lymph nodes drains the upper half of the face, temporal region, auricular and external auditory meatus, and the gums. Upper half of the face, temporal region, upper half of the face, temporal region, the external auditory meatus, and the auricle and the gums. Identify this picture, microscopic picture of the malignant melanoma lymph node metastasis. Note the pigmented cell. These are the pigmented cells. So whenever you see such a slide on anatomy station, always say this is malignant melanoma. Where can you palpate the facial artery? So facial artery can be palpated 2 cm from the angle of the mouth here. Sometimes we ligate it when it is highly pulsatile. So can be palpated in a spot about 2 cm lateral to the corner of the mouth. Can be palpated as it crosses the inferior border of the mandible adjacent to the anterior border of the masseter, Okay, so types of parotid salivary secretion. So serous parasympathetic stimulation produces a water-rich serous saliva. Oral, the secretion are serous, parotid serous, and the submandibular is mixed, and the sublingual is mucinous. And sympathetic stimulation leads to production of low volume enzyme-rich saliva. Differential diagnosis of parotid lump. Infection may be parotitis, mumps, obstructed duct calculus or external compression, neoplasm, pleomorphic adenoma, Warthin's tumor, and then deep parotid lymph nodes. These are the swellings differentiates of the parotid gland. What is Frey syndrome? Frey syndrome is basically happens because of the damage to parasympathetic fibers from the auriculotemporal nerve, resulting in excessive distatory sweating in response to slight stimulus. Damage can be caused by parotidectomy or temporomandibular joint dislocation, and this is incomplete. Damage to parasympathetic fibers from the auriculotemporal nerve and their regeneration into the sweat glands and the blood vessels. So wherever there is parasympathetic stimulation, so there will be flushing of the face and sweating of the face. So this is called Frey syndrome or auriculotemporal nerve syndrome. Okay, so this is very important and confusing. I will go through this quickly. So here, okay, how to locate the, or you can say the surface anatomy of the parotid gland. So remember surface anatomy of the parotid gland, clear cut and forever. So here we have one point. So where will this point occur? This point is this point. This point. Where is this point? This point is located on the condyle of the mandible. This point is a condyle of the mandible. And another point, when you ask the patient to clench the teeth, you will feel the masseter muscle. So a little above the mid of the masseter muscle. A little above the mid of the masseter muscle. And another point is 1 centimeter or 2 centimeter below the angle of the mandible and behind the angle of the mandible. So another point will be here. Another point will be here. So join these points, this point and this point. Now another point is the center of the this mastoid process. Okay, center of the mastoid process. Join this with this line. Okay, and join this condylar point with the center of a, but in a curved line which is concave above, towards above, concave to, so which concave surface is above in this line. Okay, so this is the posterior border. You can say this is the lower border, this is the interior border. So this is how we look at the parotid gland. So remember, first point at the condyle of the mandible, another point just above the middle point of the masseter muscle, and the third point will be below and behind the angle of mandible, 2 centimeter or 1 centimeter, and another point will be at the center of them, this mastoid process. Join all these points, you will get the parotid gland. Another submandibular gland duct opening. Submandibular duct, what duct is called Wharton duct, and open lateral to the lingual frenulum on the interior floor of the mouth. 5 centimeter in length, lingual nerve wraps around the Wharton duct. This is important. As the duct passes forward, it crosses medially, means it is medial to the this lingual nerve, and it goes and above it and then crosses back. So it goes above the nerve and then crosses again back behind below the nerve to reach position below the nerve. Okay, so here you can see this will be the, let's suppose this is the lingual nerve. So this is the lingual nerve. So the duct goes here medially, but it goes above first and then below it. Okay, so submandibular gland type of secretion, mucus plus serous, sympathetic derived from the superior cervical ganglion. Sympathetic will come from superior cervical ganglion, and then we have the parasympathetic submandibular ganglion through the lingual nerve. So it contains the this parasympathetic supply from the submandibular ganglion, superior salivatory to the lingual nerve, which is also a branch of the mandibular nerve. Arterial supply, branch of the facial artery. The facial artery passes up through the gland to groove its deep surface. It then emerges onto face by passing between the gland and the mandible. Venous anterior facial vein lies deep to the marginal mandibular nerve, and lymphatic drainage deep cervical and jugular chains of nodes. So here is this relation. So this is the lingual nerve and this is the duct. Medially and then above and then below it. Which salivary gland is the most susceptible for stone formation? Submandibular gland. Why? Because its secretion are mixed rather than serous. A duct opens into the floor of the mouth and flow is in anti-gravity fashion. Its flow is in this anti-gravity fashion. So lingual nerve anchors the Wharton's duct and forms an indentation in the middle one-third of the duct. So in the middle one of the duct, because it goes above and then it goes below, so the lingual nerve forms indentation. So all these results in stasis of the secretion, and it will cause stone formation. Nerves, arterioscope, injury, submandibular gland excision, lingual nerve, hypoglossal nerve, and marginal mandibular branch of the facial nerve. Marginal mandibular branch of the facial nerve, dropping of angle of mouth, and the lingual nerve because loss of general sensation interior two-third of the tongue because it supplies, and hypoglossal nerve below, deviation of the tongue to the affected side on protrusion. So this is all about the submandibular gland as well.